So I've been paying loose attention to this healthcare debate that's been going on in the States, and there's been a lot said about socialized medicine, and 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 of course Canada is always mentioned as an example of socialized medicine. Um, and the idea of socialized medicine is, you know, is sort of used as a derisive target. And Canada has a single payer system. And I wanted to share my experience with the healthcare system in Canada. And hopefully it will illuminate things for people who are afraid and who have heard a lot of stories about wait times and horror stories and that sort of thing. Um, I've had occasion to use the healthcare system in Canada twice, and I'm talking about in a big way. I'm I'm not talking about, regular doctor's visits, hospital stays. And the first occasion was when I had my son. The second one was more recently, quite recently actually, where my son injured himself at school. Now, he was taken from school in an ambulance to the emergency room. When he got there, he saw the emergency room doctors. He had X-rays for his knee. He got pain meds, and then was admitted. He was admitted to a private room with a private bath. Um, the room looked just like any normal modern hospital. It had monitors, it had a IV pump, it was spotless and very new and bright. And there was a monitor that he could watch a cable on and surf the internet, and there was a small fee for the those optional services. And I think that it wasn't anything more than maybe $30 for those services for a couple days. So the staff, there were nurses who came in repeatedly throughout the whole afternoon and night, to check his pump and to make sure, to check his pain level and ask him if he needed more medicine. And they monitored him, and his surgery actually was scheduled for that same day. However, he had eaten, so he needed to fast, and which is why they kept him in the hospital that extra time. So I was encouraged, or rather his father and I were encouraged to stay the night if we needed to. And I ended up staying the night. There was a pull-out cot, or sofa bed in the room, and the point I'm making is that this was just a normal environment, as far as I know, normal for us. This is what happens when, and my son had a private room because children receive private rooms, and it's covered under the healthcare plan of Ontario, which is where we live. So the following day he had his surgery. The doctors came out and talked softly to him in the hallway while, we were standing there, and we talked with the doctors who were going to be attending to him during the operation. And he went in and had laparoscopic surgery, and he came through it great, and was returned to his room. He was given more pain meds. The whole time he had a splint on his leg, and The staff was just wonderful. They were knowledgeable, they were brisk, they were supportive and competent, and they helped us immensely. There was I mean, it was a stressful experience because of what was happening, but it was made light by the fact that those burdens were taken off our shoulders. We didn't have to fill forms out. We didn't have to only consent forms. There were no insurance information requests. We didn't have to, think about that sort of that. All the work, all the grunt work, all the paperwork was done by the hospital staff and by the people who work at Health Canada. So, and okay. And so when he was released from the hospital, he had appointments made for him for follow-ups at intervals for a 6-week period while he was healing. And he went to see, before he left the hospital, he actually was kept an extra day because the consultant who teaches, people who have injuries how to use their crutches wasn't available. So they kept him an extra day in the hospital, and he saw the consultant, and she taught him how to use his crutches, and he was sent home. Then what I'm trying to get at is there was no cost for this other than maybe $50 total for those optional things that that were purchased, and all the meds, the x-rays, the doctors, the surgery, everything, the pain, everything was covered under the plan. And what people don't understand about socialism, and I know socialism has an official definition in political terms, but socialism also means, in a general sense, a cooperative venture as opposed to a competitive one. And it's where people come together, people who have common needs, and these people come together to satisfy those needs for the whole group. And there's an agreement made that people who need help urgently will go to the front of the line, and the ones who have less urgent concerns will yield to the people who need help right away. And it is, for me, nature is a cooperative venture. It's a model of nature. Cooperation is a model of nature, and there's no more successful venture than nature. And I can't understand why there is this drive for competitiveness in the States, and the belief that somehow healthcare should be included in that competitiveness. Healthcare is not like buying jeans. I mean, and I hope what I've said helps to shed some light on the nature of a single payer system in the way we in Canada do it, and to see that there's nothing to be frightened of. It was, a stress-free experience, and all the burden was placed on people who have been hired to deal with that burden, so that it was taken off the end user's shoulders, which would be me and my family. And that's my story. Thanks for listening.